Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss the Ayurvedic herbal treatment of Hepatorenal Syndrome. Now this is a very rare disease but a very serious disease which invariably becomes fatal in a few months. Now what happens is most patients who have liver damage and gradually develop cirrhosis of liver, they go on to develop swelling in the abdomen, fluid accumulation, which is known as ascites. And more than 40% of such patients who have cirrhosis, liver cirrhosis as well as ascites, they go on to develop this disease which is known as hepatorenal syndrome. Now the liver is already damaged. What happens is the effect of this liver damage is working on the kidneys, and gradually the kidney function also starts reducing. So both the liver as well as the kidneys are affected, and modern medicine believes that once the diagnosis is made, usually patients have just a few months to live. There is no specific treatment for this in the modern system of medicine other than liver transplant. But now this is one sort of disease which can be invariably fatal, but Ayurvedic herbal treatment can be given in such patients to dramatically change the overall prognosis and the poor and the high mortality rate of this disease. Now Ayurvedic treatment is given in very high doses. The treatment needs to be very aggressive, but first the treatment needs to be targeted to the to reverse the liver damage to the maximum extent possible. And we have seen that the swelling or in the abdomen or the fluid collection, which is known as ascites, starts disappearing in just 2 to 3 months of treatment, and within 4 to 6 months even the both the liver parameters as well as the kidney parameters start returning to normal. Now once all the symptoms have subsided and the parameters are normal or near normal, then we can think of gradually reducing the dose of the medicine and tapering the medicine to see whether there is a relapse. If we feel that there is some sort of chances of a relapse, then we can continue some medicines in smaller dose for a longer period, or we can also give booster treatments, say for about 2 3 months at a time for some time for the next, say about 1 or 2 years. But overall, such patients who are expected to have a high mortality rate can be treated very well with aggressive Ayurvedic herbal treatment. So we can say confidently that Ayurvedic herbal treatment can very well treat hepatorenal syndrome and bring about excellent results. So friends, let's meet in the next video. Goodbye.